when I look at the clips you've shown and the people who've spoken, it really is inspiring because we are all inspired by people who've gone before us. And when I came to the organization, Nyaho, I did not start it. It was founded by my father, and my mother then took after him. And I realized that, the heights, my father used to say, the heights that were reached and kept by great men were not attained by sudden flight, but they, whilst their companions slept, were toiling upwards through the night. And my father was a giant. He was a diaspora. Before Ghana gained its independence, he was one of the few Ghanaians who were trained outside in Ireland, in Trinity College, before Ghana had its own medical school. And when he trained as a doctor, he came back. And he came back to serve in the military, in 37 Military Hospital. He rose to become the medical director for the Ghana Armed Forces. So when I look at his achievements, the question is, why did he move outside of this secure future to set up a very risky endeavor of starting a group medical practice? He didn't start it on his own. He brought people together. And that teamwork is what I believe has kept the organization going for 53 years. 53 years of running an organization that is 24 hours is no easy feat. So you look at the organization now and you think, it does not have problems. It has many problems, many challenges. It has gone through the ups and downs of our 70s, 80s, 90s, and different people were there. So when we look at the problems that we face now, it is for the team that is in place, the people who are there now, to figure out solutions and provide a support, a solution for the future generations that are going before us, because we are stewards. So I see myself as, standing on the grounds, which is the ceiling that my father and my mother have created, which is very much challenging. And we have to acknowledge that we are all stewards, and it is not easy to continue a legacy. If you grew up in a family, I think that all of us look up to our parents, we look up to those around us. Sometimes we have good examples, sometimes we have bad examples. We look at our governments and we look at people in leadership, and we look at what is the model of leadership that we have. I think that we can look and see great examples. I'm inspired personally by someone who was on your show, Patrick Ewa, who started at Ashesi University. And one thing that is consistent, when you study the stories, you see that it has been challenging, and the challenge continues. There is something about resilience and perseverance that in order to change the things that we see, it does not take just chance. It takes perseverance, it takes hard work. And we need to show this hard work. We need to show the impact it has on your mental health, the impact it has on your being a family man, being there for your family. And so for me, this topic is about how do we address the challenges in healthcare. Because what brought me back to Ghana, I trained in the UK, but what brought me back was to identify that I had a part to play in this problem. If we train doctors and doctors leave the country, it is a challenge. Nurses and doctors, we know in the news today, in the last few years, there have been an increased flow of doctors and nurses and healthcare professionals who are moving out of our country to other parts of the world. And there are many reasons for that. All of them want to have a better life. They want to develop their skills. And to develop your skills, you have to go to where those skills are being taught. That is happening outside of our country. In order to create a better value for your family, to do better, sometimes the opportunities are there, and you have to take the opportunities. So when we look at these problems, we have to understand what is the root issue. It is not because Ghanaians don't want to see Ghanaian healthcare improving, it's because there are real challenges and they're trying to find solutions. But that poses a problem for our healthcare delivery. The WHO and the Ministry of Health have identified that Ghana will not be able to achieve universal health care coverage if this is not tackled properly. We know that the Ministry of Health has been looking at skills and labor gaps, what is required for our healthcare labor market to improve. The Ghana Health Service is trying to increase jobs, is trying to increase wages, is trying to look at how to give people time off to study. But is that enough? And for me, my assessment of the situation is that that is not enough, because it does not address the root issue. Why do people leave in the first place? People leave because situations here are challenging. I work in the private sector, and in the private sector, I can tell you that the last 2 years, no, actually, the last 3 years with the COVID pandemic, private sector struggled because there was no funding. You had to find a way of engaging and doing what you were called to do to save lives. No doctor and no nurse is not oblivious to the fact that you have to save the life in front of you. But when you are tired, when you are not addressing the mental health strain, to ask someone who is worried about their livelihoods, who's worried about the base, how to supply food for my family, and ask them to aspire to a greater height of thinking, of empathy, you have to address the root issues. And so as a private organizations, this has been a challenge, especially with the economic crisis. How do we create better jobs, better conditions of service? I can tell you and honestly that we have struggled in the last few years to provide that for our staff. However, we have not given up, and that is the legacy of my parents. When I look at the situations that they faced, if they could do it, we can do it. Even though we walk through the valley of the shadow of death, it's a shadow, we will walk through it. But it takes perseverance, it takes hard work, and we need to demonstrate to the youth, we need to demonstrate to everyone who's coming in that it takes a lot of hard work, a lot of sleepless nights. So I am looking at the situation, I'm asking myself, how do we solve this? Because public sector cannot do it on its own. The government has so many competing interests that how do you put the right resources to address the challenge? The first challenge is we don't train enough healthcare professionals. That is really challenging when you have only 8 undergraduate medical programs. Our doctor-to-patient ratios are the lowest if you look at the world, if you compare to other parts of the world where people are moving to. There's a global health shortage. So if the UK has a global health shortage, yet the doctor-to-patient ratio is high, and we are coming from a low base, it begs the question that we're not tackling the supply and demand question, that we need more supply. But we have a young population. We have an opportunity. It's not a problem if you change the lens. It's an opportunity. We have a young population who are looking for jobs, who are looking to better themselves. So we need to focus on training and training more people to become better skilled. It's not enough to do the basic training. People have to aspire to better because around the world, people have moved on. So if you try and just train on basic community care, I am not saying that that is not needed in a country where we have to deal with the basics, infection and prevention control, where simple hand hygiene, simple mosquito nets can make a difference. We have to lay a great foundation. However, with the use of technology, with the use of artificial intelligence, the world is moving on to giving tools that can help people do more and better. So it means that if we do not keep up in terms of how we train and how we empower and enable these young people, we'll be teaching things that were relevant 10, even 5 years ago. Meanwhile, the speed of evolution is moving quickly. So there is value in engaging in the diaspora. There is value in engaging in what's happening around the world because it's combining the two things, bringing the best of our people who have gone out of the country, who are in these new systems, to the best in our country, who are aspirational, who are full of grit and resilience, who keep pushing on, and bringing them together. So the public sector cannot do that on its own. Private sector cannot do this on its own. Private sector is challenging. The tax regime, when I look at my relationships, I'm the chair of a group of specialist hospitals who came together during the COVID pandemic because we had to engage. We are not competitors. We are all in this together. We don't even do the simple things that you can find in other countries. So we have to figure out what is the root issue. The policy regimes need to change. If your cost structure, if the cost of electricity, the cost of water, the cost of bringing equipment which are made outside the country, which are dollar denominated, the equipment that you use, your CT scans, your x-rays, all of these are dollar denominated. If you are bringing in people who want better paid jobs and you want to train them, you need to put money towards their training. And if they're going to be traveling, you're going to be paying flights, you have to pay accommodation. How do you look at this cost structure, which is dollar denominated, which is heavy, and try and get revenue that can even sustain that? A lot of hospitals compromise with quality. Instead of doing continuous professional development, it's a choice between paying for drugs or developing people. And so this is something that the government can help with by working together and looking at the policy regimes that create a fair and enabling environment. A public hospital should not be cheaper to run than the private hospitals. All need to be in the same playing field to allow for the right investment in people, in developing our people, so that we can create a good quality healthcare system. So we need the two. And I think I'm beginning to show my theme that it's about the people who are in the country and the people who are out of the country. It's about the public sector and it's about the private sector. It's about the teamwork. And this has been my analysis of Nyaho. How could an organization survive for 53 years, despite the challenges that we've gone through coups, through famine, through different challenges, and it's continued because of teamwork. It's been because people have put aside their differences and looked for what is common and what connects us all to solve a bigger problem than our own individual problems. So I'm extremely passionate when I look at this problem because it is solvable, but it takes humility, it takes hard work, it takes persistence. We should not give up. It will take time. So I look at countries and I'm excited because we have examples in the world. I know people talk about Singapore, but I would like to talk about Cuba. Cuba as a country is a case study because Cuba is a net exporter of its healthcare talent. A net exporter because over the years, they made certain decisions. They were going to develop their people. So they trained a lot of doctors and a lot of nurses. Cuba for me is interesting because they did not see that brain drain as a problem. They saw it as an opportunity. So Cuba has $11 billion at last count. I was reading an article, $11 billion of revenue that is generated through bilateral agreements with countries. They export over 50,000 doctors in 67 countries. These are relationships where the countries pay Cuba to export its talent. That means that that is an acknowledgement that people are going to be going to other countries. But there's a way that the country can benefit if they can actually formalize the agreements and get paid so that they can use that amount of money to train more people to replenish. I think that policy is interesting and should be studied and should be asked, what does it take for us to do this? Because if I look at Cuba, we have Cuban doctors in Ghana. Cuba, I mean, it's an amazing, their life expectancy is better than the US. People live longer if they live in Cuba than in the US. It's worth asking if Ghana is exporting, and at last count, over 50% of all doctors who've been trained in Ghana are outside of Ghana. And over 24% of nurses who've been trained in Ghana are outside. So if we can acknowledge that this is a problem that can be solved, but will take creativity and an entrepreneurial spirit, I think we can find a solution.
Thank you very much, Dr. Elikem Tamaklo. And he is very clear about one thing. It is a challenge to train medical professionals who won't stay. One of the reasons they won't stay, very obvious. They're looking for better opportunities. He says there are only 8 undergraduate medical programs. That's woefully inadequate for a population with a lot of younger people looking for better opportunities. You need to go beyond training in only the basics. And you just referred to how over 50% of the medical professionals trained in this country are not here. So, your major solution to that is what exactly? I like your perspective about this particular scripture. You said that in the valley, it's only a shadow of death and not death.
Yes.
In 2005, I did a documentary for the BBC. I included one of our speakers who will be joining us, Dr. Arthur Kennedy, and I discovered, to my shock, that the doctor population, Ghanaian doctors in New York, were far more than the total of the doctors we had right here in Ghana. What do you say is the one bullet to resolve this?
It's hard to say one bullet. Allow me to give 3 key areas. 1, the policy framework, the environment has got to be such that we make it easy for Ghanaians who have family members here. Ghanaians are not, we care about our country. I was in the diaspora, I care about my country. My family are in this country. So diaspora, the doctors in New York, care about their family. And if engaged, how do we create a framework that makes it easy? Because right now it's difficult for doctors to come and even work in Ghana. Yes, you have to do a number of steps. So let's look at what are the blockages for people to come back, even if they're giving back. Medicine's an apprenticeship. They have the skill. So see one, do one, teach one. They've seen it. They should do it in the country and teach someone else. They can keep on going back, but their legacy, let's make it easy. We need both public sector, but private sector is where the funding entrepreneurial spirit comes from. We need to bring that connection together. Number 2, we need to look at financing. If we do not tackle the job situation of people being better paid, then that is still going to result in a net export. I believe that we need to acknowledge that people are going to leave. How can we find a revenue generation stream that can bring some revenue back? And I think that is with thinking through how we structure our jobs. I think that is where I'm looking at engaging diaspora to do that, but I need to work with a team. We need to be a part of the conversation. It takes the last thing, unity. We are all in this together. If my mother falls sick, during COVID, we saw this. If my mother falls sick, I told her that in our hospital, even though we're a COVID center, we only had 2 ventilators and patients were on those ventilators. I said to my mom, I cannot do anything if you fall sick because we do not have enough. So stay and be safe. I think that we have to tackle the infrastructure problem as well. And that's where the investment, the enabling environment is skill plus equipment and infrastructure. So I think that this is my 3 areas: policy, training, and investment.
That's how to bridge the gap. Now, you were trained in the UK, had better opportunities, and still you decided, like a few others, to come home. Mm-hmm. For you, the push factor, or is it the pull factor? You said you're standing on the grounds, which is the ceiling created by your father and his team. Up to this point, do you have any regrets, or you are seeing the problems as only a shadow in the valley and not death?
The valley, I love that phrase because the valley of the shadow of death, I think that I'm a Christian, so I take a lot of faith from the Bible. And for me, the only way I've been able to go through this period of time has been with grace. And I say that because it's been extremely challenging on my mental health. My mental health in terms of anxiety is the shadow of death. It's not death. So I'm not dead.
Right.
But that shadow is causing fear and anxiety. And we do not tackle this topic in leaders. A lot of leaders are isolated. They are supposed to be the big man, the strong man. They're supposed to take care of other people. No one is looking out for them. And so I think that my lesson learned, and one thing I say for all leaders, acknowledge your mental health. Acknowledge that you're human. If you do not take time to rest, if you are out of the game, everyone in your organization cannot get through this. So you need to take care of yourself first. Give yourself oxygen before you can give other people oxygen.
Thank you very much.